Hello and welcome to this video. My name's Kris, I'm an Australian GP, and today we're going to be covering Fertility 101, essentially the video that you want to watch when you are trying to conceive, are interested in what it takes to conceive, or if you're just interested in fertility in general. So what does it mean to try to conceive? As the name suggests, it's when a couple decides that they want to have a baby. To conceive, you do need to have a sperm and an egg, have them meet, embed in a uterine lining, and develop over a gestation of approximately 9 months. The sperm and the egg often will meet via intercourse, which I'm not going to explain today, but I do want to highlight right now that this is not the only way, nor is it the only valid way to conceive. I also want to highlight, I will use terms like women, but I do want to acknowledge that not every uterus haver. I also want to highlight that not everyone with a uterus will identify as female, and not every person who has a pregnancy will identify as female. I also want to acknowledge that in a couple, there doesn't have to be a man and a woman. There are very, very valid and varied ways that families can form together, and I do acknowledge that. I will do my very best in this video to be inclusive and to use neutral language, but please let me know if I slip up. I am trying my very, very best, and I know that at some point I will make assumptions such as, say, man and woman. Obviously, this is not the only case. So statistically, 95% of couples who determine that they want to try and conceive will conceive within 12 months. So all of that to say that we don't actually look to see if anything is wrong medically until you've been trying for over a year, which is a very long time. I appreciate that. This will vary depending on so many things, including your past medical history and the age of the person with the eggs, as it is known that as we get through our 30s and over 35 years old, it does become more difficult to conceive. For couples who are trying, there is an about 20% chance every month that with regular unprotected intercourse, they will fall pregnant. It is suggested that in the week of ovulation, couples aim to have intercourse every 1 to 2, sometimes 3 days. 2 days seems to be the sweet spot. Quick note, pregnancy actually doesn't begin at the time of conception. It begins when we time it from the first day of your last period. This is because that's when the egg starts to form. And so it's really, really hard. So let's say you're 4 weeks pregnant. You only really got pregnant 2 weeks ago, but you're 4 weeks because 4 weeks ago that egg was forming. So it's a really difficult thing to wrap your head around sometimes. And some pregnancy tests will say you're 1 to 2 weeks pregnant, which means that the egg met the sperm 2 weeks ago thereabouts. So just be aware that there is a very medical way to count pregnancy from the time of your last period, the first day of it, that is. Those of us with ovaries tend to ovulate about once a month. And this is usually about 14 days from the first day of your menstrual period. So mid-cycle. Again, I would really like to acknowledge here that not everyone has a 28-day cycle. Not everyone has a smack bang copy-paste type period where every month on day 28 they'll get a 5-day period and blah, blah, blah. It's not textbook. It's not going to be that simple. So it is sometimes difficult to guess when you will ovulate, and using online apps that take the average may not give you the most accurate answer as to when you're ovulating. Once ovulation has occurred, that egg is only viable in your body for about 12 to 24 hours. That's really not a long time at all, especially when you're working and you can't just go and get sperm. So let's flip to the other side of it, the sperm side. Once sperm is released into the vagina, it can last up to 5 days and fertilize an egg within that 5 days. That's a lot longer than the egg. With all of this in mind, there's really only a few days a month that one can fall pregnant. So we like to think, okay, if we ovulate day 14, and sperm can last up to 5 days. If we start having regular unprotected intercourse 5 days prior to ovulation, again, really hard to guess when ovulation is, but 5 days prior, then every second day, we will very likely either have intercourse or inseminate on the day of ovulation, or right before or right after in that 12 to 24 hour period when the egg is actually viable. Really, it only takes 1 egg and 1 sperm to fall pregnant. So whilst I may reassure you now that it is harder to fall pregnant than you may think, If you are having unprotected heterosexual intercourse with penis and vagina, please know that there is a chance you could fall pregnant. Even if you think you haven't ovulated yet, if you ovulate in the next 5 days, you could. If you're not, if you think your period is just about to come, you still don't know if you've ovulated. So it's really, really worth protecting yourself if a pregnancy is not on the cards for you. So what can you do to increase your chances of conceiving? Sadly, there's no one, quick fix vitamin or anything like that to make you more fertile, nor is there a specific position or time to have sex or position to have sex. It really comes down to making sure that you, both the person with the uterus and eggs and the person with the sperm, is in the best health possible. It's suggested that we cut down our caffeine to under 200 milligrams a day, which is about 1 to 2 coffees, a couple of teas, maybe a couple of soft drinks. Just watch your caffeine. Eat a varied and healthy, balanced diet, including nutritious grains, vegetables, fruits, complex carbohydrates, although grains kind of same thing, healthy fats, that sort of thing. Cut down on smoking. Obviously, cessation is ideal. However, I do appreciate this is not easy for everyone. And reduce your alcohol intake. There is no safe amount of alcohol to consume during the 9 months of pregnancy. And if you think that conception occurs midway through a cycle, and technically when you've conceived and 2 weeks later when you get your positive test, you're actually 4 weeks pregnant, it is ideal that you stop drinking well before you start trying to conceive. I also strongly urge that you talk to your GP about ensuring that any pre-existing health conditions are really well managed. We also suggest that the one with the egg and the uterus takes a folate and iodine supplement for at least a month prior to conception, because this really helps with bub's development during the pregnancy. And ideally, you start this before you conceive, though as soon as you find out, if you haven't been on supplements, that's fine. Start them as soon as you find out. So that's pregnancy basics and how to fall pregnant 101. A lot of people trying to fall pregnant will find themselves on pregnancy forums online. Maybe you've already been on them, and maybe you've gone and left because there were so many acronyms and it's so confusing. So let's break down a couple for you. TTC is trying to conceive, basically trying to have a baby. CD is cycle day, basically how far through your cycle you are, remembering day 1 is the day that your period starts. DPO is your days post-ovulation. Now, again, some people will assume day 14 is ovulation day. Some will use apps to track their cycle and get a guesstimate of when they ovulate. And some use other methods to try and gauge when they ovulate, including Ovulation Predictor Kits, which we'll go through in a little bit. But essentially, DPO, days post-ovulation, gives you an idea of when you might be able to test to get a positive, test. TWW is the 2-week wait. Essentially, most people will test positive on a pregnancy test about 2 weeks after they ovulate. This 2-week period can be excruciating for couples who are trying to conceive, because any symptom may be a pregnancy symptom or it may be PMS. You might take a test and it's negative, but it could turn positive later. So it's a really difficult time for people going through the trying to conceive journey. A BBT is your basal body temperature. And this is one way of tracking your fertility and trying to gauge when you may have ovulated. The basal body temperature is often taken with a very specific, very accurate thermometer, and it's usually taken when you first wake up in the morning. There are charts on how to track it, which we won't go into, but just be aware that some people use this as not only a natural fertility, as in pregnancy prevention method, but also to gauge when to have intercourse during the cycle. A BFN is a big fat negative. That's a negative pregnancy test. On the flip side, a BFP is a big fat positive, which is a positive pregnancy test. CM is cervical mucus, because there are changes during the cycle that the cervical mucus will undergo. Changes in consistency and frequency of, having mucus, or how much there is. And some people will track this to try, again, gauge when they may or may not have ovulated. A UPT is a urine pregnancy test. This may also be written as a HPT, which is a home pregnancy test. These tests look for beta-HCG, the hormone released by a developing embryo in the uterus once you've conceived. An OPK is an ovulation predictor kit, which I kind of alluded to earlier. These are strips that look for peaks in certain hormones, including LH or luteinizing hormone, to determine if you have likely ovulated within the last time period, 12 to 24 hours. Some women in the middle of their cycle will use these daily to try and figure out when the best time to have intercourse is. A CP is a chemical pregnancy. This is a pregnancy in which there is some release of pregnancy hormone, beta-HCG, but the gestation isn't visible on scans, ultrasounds, and ultimately these pregnancies go to miscarry. Typically these are under 6 weeks, so some people may not even know they're pregnant at this point. There are obviously so many more acronyms, but I think that's going to do it for today. So if you've got any questions or anything you want me to elaborate on, please let me know. As always, leave me a comment and subscribe if you haven't already, and I will see you in a video very soon. Until then, take care guys. See ya.